afternoon everyone. 90% of our work is related to urology. So we admit urology and nephrology only. So related to urology, 90% are surgical or non-surgical? Surgical. Urology is what? Surgery. Which surgery? Kidney related surgeries. Nephrology is what? Medical. Dialysis, BP, sugar. So in urology hospital, what patients normally, echo patients, what are the normal patients? Surgery. What surgery normal? URSL. So you should know what is URSL. Compulsory. URSL. By heart. By heart you should know. Ureteroscopy lithotripsy. How it is done? You pass a scope through the urine passage. What is the passage called? Ureter. Ureter. Ureter is pipes. Urethra is below. Last passage. Urethra you go. Next what will come? Bladder. Next what will come? Ureter. Next what will come? Kidney. This you should remember. Urethra first, bladder next, ureter next, kidney next. Etla pote from below up. From above below step, first time was kidney, ureter, bladder, urethra. So if you come from above, urine comes from above below or below above? Above below. So first structure A, B, C, D vastada, D, C, B, A antava, A, B, C. So first structure in urology is what? Kidney. Second? Ureter. Third structure? Fourth structure? Urethra. Ante, that's all. 90% of the ward sisters should know this. In males, 2 testicles are there, 1 penis is there. That also you should know. Everybody knows. In female, vagina will be there. And anus passage, lateral passage will be there. Examination purpose. So again I am telling you, kidney, ureter, bladder, urethra should be remembered. Common surgeries we will discuss today brief, not detailed. URSL is common, I told you. Ureteroscopy, it's not. Ureteroscopy, ureter. Ureter is above, urethra is below. Ureteroscopy means you pass a long scope, you go into urethra, you go into bladder, you go into ureter, you can go into kidney also. Okate passage. When you are going, have you ever imagined how you can go into small structure? Have you gone to theatre? Anybody seen URSL? You have seen. You should see. Daily how many URSL happening in our hospital? 4, 5. URSL, you are right. Go and see in the theatre how URSL is done. Then you will understand what post-operative care we can give. When it is passing, the urine tube pain will come or not. That's why patient will tell, I am feeling to pass urine, I am feeling to pass urine, I am feeling to pass urine. Why? You have passed one tube and you have put Foley's catheter also. You are understanding what I am telling? So whenever you do ureteroscopy, there is a camera scope system. You watch in the TV or directly? TV. You should see that in the theatre one time. One day you allocate. Then you go to the theatre and see. When you are not on duty, you come to the operation theatre and see. When you do ureteroscopy, you go into the ureter and then break the stone. That is called lithotripsy. Litho means stones, tripsy means breaking. So ureteroscopic lithotripsy. And stone, you go to ureter and break it. After that, what will you do? Stent will place. Have you seen stent anytime? Get one stent. Stent have you seen? All of you have seen the stent? Sure? ఎప్పుడు చూసారు? When you have seen the stent? Theater or outside? Sometimes falling out or patient giving like that. You should see stent how plastic it is. So it causes irritation. Frequently you have to go urine. Urgently you have to go to urine. Like that. So ureteroscopy, lithotripsy, all these are called endoscopic procedure. What is difference between endoscopy, laparoscopy? Anybody can tell you start. Endoscopy ki laparoscopy ki difference. What is the difference? You write laparoscopy. You write endoscopy. What is laparoscopy? Lapar means potta, abdomen. So if you make scopy means choda. Potalo hole is choda. Laparoscopy. Endoscopy means natural holes. Tell me what is natural hole, one hole. Right? This is not natural hole.
Yes.
This is not natural hole. This is not natural hole. This is not natural hole. Urethra, anus, vagina. How many? 1, 2, 3, 4, 5, 6, 7, 8 in females. You got the point? These are all natural holes. Whenever you put any tube through a natural hole, it is called endoscopy. So, how you are not knowing the difference between endoscopy? This is the way stent looks like. Inside you have seen white one. That white one is a stent. You have seen, everybody see. Stent, that white one is a stent. Inside. The red one is a pusher to push. White one is a stent. So that will be put. Why 2 rounds are there? Tell me anybody. Why 2 rounds are there in stent? One will be in the kidney. Other will be in the
bladder.
In between, it can fall down. Not to fall down, there is a
Coils.
coil. You see the coil you have seen? White coil. That will hold in the kidney. That coil will hold in the kidney, so that it will not fall down. Fine, have you seen that round pigtail? It is called pigtail. You have seen pigtail? Pig అంటే మాకు పిల్లలు తెచ్చుకుని ఏం చేస్తారు? పిగ్ అంటే ఆలోచిస్తావు నువ్వు తెలుసా? యు నో పిగ్. Pig, you know, tail how it is round. You see there that tail? That is called pigtail. One side it is called pigtail. Two side it is called double J stent. J. Actually pigtail that. Why it is kept? To keep it there. It won't fall down. You have to pull it out. So ureteroscopy is passing the scope from the urethra. The urethra in female is small or male is small?
Male is female.
Female is very small. Male urethra is penis will be there. How can you say female failed? So female urethra is small. You can immediately enter into next structure to urethra is 1, 2, 3 order lo. Urethra, bladder,
Ureter, kidney.
So after urethra, what will come? Bladder. After the bladder, where will you go? Nobody is speaking. Ureter. Then you will break the stone. And those stones will be removed and you put a stent. So that stent you can pull out after 15 days. Stent removal. So after 15 days, patient will come for stent removal. This is the surgery. This is done for the ureteric stone. I think one surgery one time is better, or should I tell everything?
One surgery one time it will be.
Otherwise they will forget everything. So you go and write down today, all of you, and spelling everything. Urethra, bladder, ureter, kidney, ureteroscopy, ureteroscopic lithotripsy, URSL, stent removal. Everything you write down and show me, we will close today. Otherwise they'll forget it. Fine? This is URSL. You should not forget this again. URSL is that. If you have picture, it is better. Give me the, you have that, this thing.
Mark on this.
Marker. ETHRA. This is urine bladder. This ureter. This, if you go, this is a hole. This is bladder. This is again hole. This is kidney. It is closed. Road is closed. Here also road is closed, but this road is there. If you go from here, it is called urethroscopy. If you see bladder, it is called cystoscopy. Cysto means bladder. If you ureter, ureteroscopy. Kidney, nephroscopy. Nephroscopy. Nephro means kidney. Nephrologist. Nephroscopy. So urethroscopy, cystoscopy, ureteroscopy, nephroscopy. If you want to go here, you have to go from here. So urethroscopy, cystoscopy, ureteroscopy, then you stone is there, lithotripsy. If you use laser, laser lithotripsy. If you use pneumatic, pneumatic lithotripsy. That if you go to theatre, you will understand. After that, you will put a stent. One stent will be here and other one will be here. This is called pigtail. This will cause retention of the stent. It won't fall down. If you get up, if you keep straight one like this, it will fall down into bladder. Then no use. Why it is kept? Because you have made powder, all the powder will come out. Because you have gone here, it may get swelling. Whenever you get accident, you get swelling here. Then you cannot move. So if you go here, this hole will become swelling. Then this stent will keep it open. Please come urine, please come down, come down. If any stone is stuck here, the stent patient will get pain here. Because water will stop here. Every minute one drop will come every second. So if it is stopped, what will happen? Kidney? Full pressure will rise. That is called hydronephrosis. Hydro means water, nephrosis means swelling. Kidney will become swelling like this. If the stone is here, it will become like this to this. Severe pain will come. So that's why pain will come if the stone is stuck here. This tube here, which is bigger, which is smaller bone, as it comes down, it becomes small. I don't know why God has kept like that. It is big here, small, small, small. So stones all come and stuck where? Below. Last part. How many centimeters will be there? This tube. Roughly, how many centimeters will be there? 25 to 30 centimeters. So stent length how much? 26 centimeters. So that it will be from here. 25 around about. Stent will be around 26 centimeters. One pigtail here, one pigtail. So to go from here to here, you need a long scope or small scope? Long scope. That scope causes inspection of which one? Ureter. That's why that scope is called ureteroscopy. Ureteroscope. Technique is called ureteroscopy. Same thing if it is abdomen. If you put a hole here, it is called laparoscopy. Endoscopy means compulsory you have to pass through the natural orifice. The ENT doctor will put from here. ENT. He will put nasoscopy, oropharyngoscopy, otoscopy, urethroscopy, anoscopy, vaginoscopy, vagina if you insert vaginoscopy, urethra if you insert urethroscopy, cystoscopy, ureteroscopy, nephroscopy. If the urine comes from above down, it is normal. If it below down, go to the urine. Does it go? No. Eppudu urine will form here. Drop, 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 drop. It will come here. This is called antegrade, normal. If you go from below, it is called dodidari. వెనకాల నుంచి వస్తుంది ఇంట్లో. వెనకాల డోర్ ఉంటుంది. ఎప్పుడైనా సాయంత్రం సినిమా పోయి వచ్చిన తర్వాత ఇంట్లోకి రావాలంటే వెనకాల దుక్కి వస్తారు. దట్ ఈస్ కాల్డ్ రెట్రోగ్రేడ్. రెట్రో అంటే వెనకాల నుంచి, యాంటీగ్రేడ్ అంటే పై నుంచి. యాంటీగ్రేడ్, యాంటీగ్రేడ్ అంటే ఇక్కడి నుంచి. రెట్రోగ్రేడ్ అంటే ఉల్టా ఇట్లా పోయి ఇట్లా పోయి. యూరోట్రోస్కోపీ రెట్రోగ్రేడా యాంటీగ్రేడా? యూరోట్రోస్కోపీలో వెనక నుంచి పోతావా ముందు నుంచి వస్తావా? కింద నుంచి వస్తాం. కాబట్టి దాన్ని ఏమంటారు? రెట్రోగ్రేడ్. ఎప్పుడు దొడ్డిదారే యూరోట్రోస్కోపీ. మనం చేసే 90 ప్రొసీజర్స్ ఆర్ ఫ్రమ్ బిలో. పీసీఎల్ ఈజ్ యాంటీగ్రేడ్. ఇక్కడ ఓవర్ఎస్ చేస్తే యాంటీగ్రేడ్. సో ఈరోజు చాలు. టుడే దిస్ మచ్ ఇస్ సఫిషియంట్. ప్లీజ్ రిమెంబర్, ఐ విల్ సెండ్ దిస్ వీడియో విత్ ఇన్ half an hour. I will make the YouTube link. I will send it. This is a class on ureteroscopy. Most important is below is urethra. You have to remember somehow. Trachpamano, tradano. Yet somehow you have to remember. Urethra is where ureter, ter. That is ter. This is tra. Both lot of difference. Last part of urine is called last part of the is called tra. The tube connecting kidney to bladder is called ter. So you have to by heart tra, urethra. Then ureter, ter. Then you use easy ureteroscopy, cystoscopy, ureteroscopy, nephroscopy. This is the way you have to remember. Today what we have discussed, URSL. Ureteroscopy lithotripsy. Ante you have gone through ureteroscopy, you have done cystoscopy, you have gone into ureter, you have broken the stone, you have removed the stone, you have put the stent. This is called URSL plus DJ stenting. That is the commonest procedure done in our hospital. Any hospital, urology hospital, any hospital, commonest surgery is what? URSL plus U means ureter, scopy. S means scopy, L means litho, tripsy. URSL, ureteroscopy lithotripsy plus DJ stent. DJ stent has to be removed. It has to be there only for 12 days. Maximum 12 days. You should maximum 12 days. So ureteroscopy lithotripsy, total procedure. After 12 days, you will remove the stent. This you have to remember. Only one time you have to remember this. Not every day. Lifelong ureter will be here only. Nee kannu ikkada potada repu. When the eye go here, hand will come here. No, same urethra, same ureter will be there lifelong. Hello? You got the point? Clear? After that it is easy to remember. Every time last 10 years, 15 years, URSL cystoscopy, URSL lithotripsy, URSL lithotripsy, URSL lithotripsy. Same scope, same breaking, same stone removal, same DS test. So one time when you are working in the ward, better to understand, so that after surgery, patient may get pain here, patient may get pain here, patient may get pain here. If the patient gets pain, it is in the nadu, loin. Patient gets bladder, below. Patient gets in the urine rasta, he will say while passing urine, my God, burning sir, burning. The blood, every 5 minutes I have to pass urine. Noppi, matta, because you have put a stent, it will be irritating. If you have something in your mouth, it's like small thing. And bite you will be saying something in the mouth. Same thing, a stent till it is removed, bladder will say please take it out, please take it out, please take it out. That's why patient will have frequent urination, urgency, frequency, urgency. ఒకవేళ ఈ stent in females if it comes out, continue urine will come directly out, wetting. This tip, if it comes out of female, male urethra it will not come out. Female it can come out. While passing urine pusukani, this stent will come out and drop. She says leaking. Then you see the private parts, white structure will be by outside. You push in with the police. Fine. So post-operative complaints you will understand only when you understand this URSL. What are the complaints in the post-op? Line pain, bladder pain, urethral pain, excessive frequency urgency, burning, blood in the urine, line pain, fever also. Because you have passed here inside, kidney will become, foreign body has come, last half an hour somebody has come, pat, they are doing, water will go inside, bacteria will go inside. That's why we give antibiotic. So fever will come in a closed room. This is a closed surgery. In this room, if suddenly smoke comes, will you get problem or not? Same smoke comes outside road, will you get problem less or more?
Less.
If a car or lorry comes, if the smoke comes, you will say like this and go. But inside a room,
Close down.
you will half an hour you will die. That is what closed system. Once you enter into ureter with scopy, it is closed room. Water cannot come out. Doors are closed. So you cannot do for a long time. Doors will rupture. In this room, everybody will jump. There is no opening. Here, any opening, it will rupture. Put water too much and pump close. That's why fever will come. Pain will come. Some amount of water will go into kidney. Pain, sore, muppi, backside pain after surgery, pain. So patient is correct. 99% of the times, patient is correct. Hey, sleep, don't worry. Why are you shouting? Sleep, don't worry. You should not say that. You should feel, give some injection, inform the urologist and give some painkillers. You got the point? So today our class is ureteroscopy, lithotripsy plus DJ stent removal after 12 days. Tomorrow if possible we will take class on the PCR. Daily one video will make. Thank you.